This winter, health experts are predicting a rise in coughs, colds, and chest infections among young children. Barnardo's is here to provide you and your family with the information to know how to look after your child at home and to know when and where to get help if your child becomes very unwell.
Chest infections are very common in young children, and we see them every year. Now, for most children, these illnesses will not be serious and they'll usually recover in 3 or 4 days, although coughs can last up to 3 weeks. There are, however, some simple things that you can do to help your child feel better. So it's really important to remember that you're the person that knows your child the best. So if they're interacting normally and are able to eat and drink, they should be fine to be looked after at home. Some babies may struggle with a blocked nose, and that can interfere with their feeding. So shorter, more frequent feeds may help until they're feeling better. You can also give them saline nose drops, and that can help them breathe easier. Paracetamol can also help bring down temperatures and can be given to children over 2 months of age. Otherwise, plenty of rest and enough milk or water to drink is the best way to recover. There are also some things in the environment which can increase the chance of a more severe infection in young children. One such example is cigarette smoke, and so whether inside or outside of the house, where possible, children should not be exposed to cigarette smoke. And of course, COVID has taught us all the importance of simple measures such as regular hand washing as a means of preventing the spread of infection.
When looking after your sick child at home, it's important to be alert to any signs and symptoms that they could be getting worse. Some young children, including newborn babies, children who were born early, or have an underlying heart or lung condition, are at greater risk of severe infections. If your child has any of the following features: difficulty breathing, including breathing fast all the time, widening their nostrils, or pulling in of the muscles below the ribs when breathing, if they're not interested in feeding, or they look dehydrated, including having a dry mouth, sunken eyes, no tears, if they're drowsy or had no wet nappies in the last 8 hours, if they're becoming drowsy or excessively sleepy or irritable, and you can't settle them with toys, TV, food, or picking up, especially if they remain drowsy or irritable despite their fever coming down. If your child is aged 3 to 6 months of age with a temperature of 39 degrees C or above, or they continue to have a fever of 38 degrees C or above for more than 5 days, if they're getting worse, or if you are worried, it's important that you contact a clinician the same day, as they can make a full assessment of your child's condition. Please ring your GP surgery or call NHS 111 by dialing 111. They can also provide general advice. NHS 111 is open 24 hours a day and can connect you to the care you need outside of your GP's normal working hours. They can connect you to a translator, but you can also ask our Bolo helpline workers to join an NHS 111 call with you to offer their support.
In few children with chest infections, the symptoms can get worse and they may need urgent medical attention. If you're worried about your child, go by your instincts and do not delay in calling 999, or if safe, taking your child to the nearest accident and emergency department. We see these cases every day, and then we can offer the best support available. Feeding is the most tiring thing that the baby does. So if they are too breathless to feed, they need to seek urgent medical attention. You also have to look out for the color. If your child lips turns blue, or if we've in children with darker skin, their lips could turn purplish. And you can also check around their gums, fingernails, tongue, and skin around their eyes. If their breathing becomes very noisy, irregular, or if you hear additional breathing noises like grunting, you need to seek urgent medical help. The glass test is an important indicator if your child has a rash. You need to do a glass test where you press a glass against the child's rash. And if it does not disappear, you need to seek urgent medical help. It is natural to feel anxious about your child's well-being. No one likes to see the child having difficulty in the breathing or coughing. Our trained Ebola helpline workers can talk you through your concerns. We will support you so that you are well prepared to look after your child.
Please don't hesitate to get the help you need.